Hello everyone, I am Dr. Mitul Barot. I am a consulting physician and diabetes specialist. I am working in Ahmedabad. I had two consulting, one at Naranpura as a Devam Hospital and Diabetes Center, and second at Bhuengdev as a Prakash Consulting. So today our topic is the role of healthy diet in hypertension. So let's talk about hypertension first. So what is hypertension? Our blood pressure always fluctuating in between range. But if our blood pressure rise persistently above the normal range, then we call it as a hypertension. As we can say, our systolic blood pressure above 140 or diastolic blood pressure above 90 is as a hypertension, right? So what is the main role of diet in hypertension? Right, definitely. For hypertension, there are many things we can manage, and by that way we can reduce our hypertension without medicine. So it's an indirect way to controlling our blood pressure. So this is the main thing. This is the main advantage, and I want to let everyone to go with this dietary management to control our blood pressure, to reducing our pill burden also. So it is a good option, right? So let's talk one by one. There are few things we have to do, and by that way it definitely direct and indirectly helping to reducing our blood pressure. So first is salt. Definitely we have to reduce our salt. As we know, we are taking meal, breakfast, lunch, the high tea and dinner, and many times we eat outside and we never count about salt. But those who had a hypertension, they had to count about salt. Definitely we are right now we are what we are eating is a high salt containing food, particularly fried food, yeah, fast food. These all are the high salty food. So as a hypertension, we have to reduce our salt limit to the 2.3 gram per day, around about 1 tablespoon per day. So reducing salt definitely indirectly reducing blood pressure. Definitely helps in reducing blood pressure, and that is the main key point to reducing the salt. So we have to take salt, but to a certain limit, around 1 tablespoon in a day, or in a gram, 2.3 gram per day. Second thing, we have to limit our blood pressure by reducing the intake of alcohol. If anyone taking alcohol, they has to limit their alcohol, or rather, best way to they has to stop alcohol taking. So it definitely alcohol is indirect way to increasing blood pressure. So reducing or stopping consuming of alcohol is the second step. Third thing is cutting down the high fatty food or reducing the weight. Definitely increasing weight lead to the increasing blood pressure. So definitely if we are planning to reducing our weight by diet and exercise, these two way we definitely reducing our weight, and by reducing weight, definitely our blood pressure will reduce. So reducing weight by many way, by dietary or exercise, we can reduce weight. Fourth thing, we can add high fiber diet, or we have to increase calcium, magnesium containing diet. These calcium, magnesium, and potassium and fibers definitely more source in vegetables and fruits. If we increase the intake of raw vegetables and fruits, definitely it gives us these ions and high fiber that also lead to definitely give us a good digestion, reducing weight, and indirectly it definitely lowering our blood pressure. Fifth, we have to decrease or we have to reduce intake of our tea and coffee. Yeah, definitely we all are like tea and coffee, and maybe we all taking tea and coffee once in a day. But once or twice in a day, tea and coffee is good. But if we are taking 4 times, 5 times, 6 times, then it's not advisable for high blood pressure patient. So reducing tea, particularly coffee, reducing at least reducing up to 4 cup a day is advisable for hypertensive patient. Let's talk about diet. There are 2 3 type of diet we can talk about. The most common and practical diet for high blood pressure is a DASH diet. So let's talk about DASH diet. DASH diet means that diet particularly for hypertensive patients. In that diet, it's a low salt, low calorie, low fat diet, and by that diet, we definitely indirectly reducing the salt, indirectly reducing the weight, and indirectly increasing the fiber intake, and that definitely helps in our controlling of blood pressure. So DASH diet is a good option for hypertensive patient. Second is a Mediterranean diet. Only difference with the Mediterranean diet and DASH diet is Mediterranean diet has a high fat intake, around 40% fat intake in Mediterranean diet, but low salt, low calorie, and with high fiber is also in Mediterranean diet. So we can select either DASH diet or Mediterranean diet, and by that way also we can reduce our blood pressure. So diet is a good and most important role in hypertensive patient. So I advise all patients definitely take a consultation of dietitian or your consulting doctor and ask about diet in hypertension, ask about DASH diet. And definitely if you are trying DASH diet or Mediterranean diet, it will definitely help you in reducing the weight without medicine, or I can say with lower dose of medicine, your blood pressure definitely in control. So this is the main culprit what I want to explain you to all my patients, friends, and colleagues, that diet had a good role in hypertension. So reducing hypertension by dietary management is a key role for first-time diagnosed hypertension, and definitely it's help in reducing patients who are already on antihypertensive medicine but still not in control. They have to reduce managing the diet, and by that way, definitely it helps in reducing the hypertension. So this is from my side. I'm Dr. Mitul Barot. Thank you all, listener. Thank you.